still only about 3% of global health financing is going towards NCDs. But what we can do is invest what we have in prevention, because we know prevention works. $1 that you spend on prevention for NCDs, you get $7 back, in health, economic, and development benefits.
Okay, thank you so much for joining us today, Dr. Etiebet. It's really a pleasure having you in this edition of the Curated Conversation, a program created by Nigeria Health Watch to gain insight from global health leaders, doing amazing work in their different spaces. Because really why we do this is, in as much as we are addressing different issues, the solutions to these issues reside in so many spaces, right? It resides in so many organizations. So really what the Created Conversations aim to achieve is get these insights and help amplify them. So really, thank you for being with us on this edition of the Curated Conversation.
Thank you for having me. It's a pleasure to be here.
Good. And you do significant work in the non-communicable and injury space, which continue to pose a significant threat to global health. So essentially it impacts billions of lives. So really looking forward to gaining insights on how you navigate that terrain, coming from your previous experiences and now leading vital strategies. So again, it's for us at Nigeria Health Watch, storytelling is a key part of what we do. So it helps make these conversations relatable. So yeah, we want to start with that, your journey to the global, into the global health space. So how did it start? What inspired you, and how has all of those experiences, how are they shaping your work now at Vital Strategies? And if I can throw in one more question, how have you seen the terrain or space evolve over that time?
Over my many years, very many years. So thank you for the question. I think it's an important one. As I like to say, I was born and bred in Lagos, Nigeria. And I think you can't live in that city, without seeing all of the inequities around you. And I remember, one image that, still strikes me to this day, of how people are selling things on the road during traffic jams. I remember seeing a girl, she was probably 13 or 14. She had a tray of fruit on her head. She was selling the fruit, but she had what we called in the vernacular K-legs. She had rickets, which, as you know, is a nutritional deficiency which causes bone growth abnormalities. But why I noticed this was because the length or the width between her knees was actually longer than the length between, her ankles and her hips. And she had to swivel her hips to walk. Wow. It looked painful just watching her. But the thing that has made that memory memorable was that she was holding in her hand what was probably her younger brother, 6, 7, 8. And guess what? He was wearing a school uniform. So when you think about that intersection of health, that intersection of education, that intersection of economic opportunity, and then that intersection of gender, these are the things that really drive why I do the work that I do. And in different parts of my professional journey, I've been able to focus, on some areas more than others. But I think the message I want to share is that all of these things are connected. When we are working on any one of these issues, we have to make sure that we are doing it in an integrated way, in a way that is really thinking about bringing together all sectors of society. This is not just about, how do we solve health, in the health sector. It's how can all health sectors, kind of come together to improve and save lives, of our families, of the people we went to school with, of the people that we know. Because right now, there are too many people on the continent dying, from preventable causes.
Awesome. Thank you so much. And so in that time, going from where you started, what inspired you to start and continue to push in this space? How has it been? What has changed, or what do you hope will?
Good question. I mean, unfortunately, not too much has changed. That's the bad news. I started as an HIV physician. I started, when the crisis was at its highest, on the continent. At that time, we had just started giving antiretrovirals for prevention of mother to children. And I also remember, mothers coming and them not being treated. I worked again, as I said, in that field, and I saw us, really taking care of people's HIV, but not taking care of their diabetes, not taking care of their hypertension, not taking care of their cancer. And so again, when you think about how far we still have to go to integrate non-communicable diseases, so the hypertension, the diabetes, the lung disease, the cancer that are actually killing the majority of folks on this continent. So right now about 41 million people die every year from non-communicable diseases. And the vast majority of that, 85%, are in low and middle income countries. And the vast majority of that is preventable. So there are things that we can be doing. I kind of liken it to, the proverb about a frog, in a pot, and the water comes, gets hotter and hotter and hotter. Chronic diseases can be insidious. When you start with one, maybe you have a headache, maybe you don't feel well, but you don't necessarily pay attention to it because you're going about, your life. By the time you really have to pay attention to it, oftentimes it's too late to do anything. And a lot of times when people are seeking care, it puts them into kind of catastrophic, healthcare expenditures, bankruptcy, puts them into poverty. But the thing, and I talked about the fact that we haven't really come too far. For NCDs, still only about 3% of global health financing is going towards NCDs. But what we can do is invest what we have in prevention, because we know prevention works. $1 that you spend on prevention for NCDs, you get $7 back, in health, economic, and development benefits. And so it's, what the WHO calls a best buy. And so the precious resources that we have for healthcare, we should be spending on prevention so that we are avoiding needless and premature death.
Oh, that's really profound. Actually, you touched on the next question I wanted to ask, which was, and also going back to what you said about, your work in infectious diseases, working in HIV as an HIV physician. We see that infectious diseases continue to get investments, get attention, of course, for good reason. But again, NCDs are rising in low and middle income countries. So my question was going to be, you've alluded to, but maybe if there's a specific message you want to pass to policymakers on why we need to continue centering NCDs conversation, in global health.
The simple answer to that is we are dying of NCDs. That's why it has to be centered. If you ask the question around, what got us to where we are right now, I would say that it's understandable, the fact that up to now we haven't really paid as much attention to NCDs as we should have. 20 years ago, the top killers on the continent were infectious diseases, but now NCDs have caught up, and they're surpassing. Now our health systems, our public health systems need to catch up. And we actually need to be able to have more adaptive, responsive, resilient, health systems that actually understand what the burden of disease is. So we can use the data, to inform where we prioritize action. There are, luckily, evidence-based solutions that we can apply that we know work. One I've been really kind of hitting here at the conference has been health taxes. How do we generate revenue? How does government generate revenue in order to be able to invest in whether it's healthcare workforce, whether it's training, whether it's facilities, whether it's service delivery, whether it's medication, for NCDs. And they're going to have to raise those resources internally because, as I mentioned before, global health financing was not covering NCDs, and we're in an even now more precarious position with global health financing, given all of this clawbacks and step backs by major donors. And so, to come back to the solution that we know works, if we tax unhealthy commodities, so tobacco, alcohol, sugary beverages, highly processed foods.
Yeah.
If we tax them enough to increase the price by 50%, we'll save 50 million lives in 50 years. So just think about that. I use my calculator, I don't know math like I used to. That corresponds to 2 lives every minute we can save, just by doing taxes. And even though that seems like a simple solution, we know it's hard to implement. We know that there is a lot of pushback, whether from politicians, whether from industry, pushback on taxes. But what we also know is if we ask people on the street, if we ask communities, the general public, if they're in support of taxes, the answer is overwhelmingly yes. 69%, 74%, when you're surveying folks, they are in favor of taxes. But with a caveat that the taxes are actually going back to invest in healthcare and that they're not just going into a general budget. So if we're taxing unhealthy commodities, those revenues that are going to support, government budgets should be earmarked for health. And I think that's where you see what I like to call the triple win. So I talked about the fact that taxes save lives. We also know that they reduce the burden on the health system because they prevent the progression of your disease. So you have less healthcare needs, and so government also has less healthcare cost. And then the other thing, that it does is that it reduces the risk factors and the prevalence for disease in the first place. So when you think about a continent like Africa that has a lot of young people, we have the opportunity to stop NCDs in their track. If we put in these taxes right now, it will reduce consumption, it will reduce prevalence of risk factors like obesity, hypertension, diabetes, etc. And as I mentioned before, save lives in the future.
Thank you so much for sharing those. So could you highlight some really impactful interventions that you've been part of, or that Vital strategies have implemented, and how you are scaling this? Because like you said, solutions are important, and we are also solutions minded. Because yes, the issues are there, but it's important not to dwell too much on them, but look beyond them to find out what's working. So what are some of those for you, and how are you scaling them?
So I'm so glad you asked the question, because one of the things I'm really proud of the way we approach our work is really approaching it from a foundational and fundamental level. How do we start by strengthening health systems? How do we start by supporting governments, to build capacity for data, for example, that they need to not just understand the problem, but to track the impact of what they may be doing. So it's a very health system centered approach. You asked earlier about infectious diseases. Our public health systems are actually pretty well equipped to deal with infectious diseases. We're sitting in Kigali right now, and we just celebrated the fact that Kigali's public health system was able to stop Marburg in its tracks. But I don't think they would mind me saying that there are still some ways to go for the public health system to stop NCDs, in their track. And so we need to make sure that our public health systems are evolving with the disease burden, that we see. The other thing that I'm really proud of is the fact that we focus on long-term sustainable solutions. So policy solutions that are not just going to impact one person, but are going to impact millions of people, when you do the policy change. And as I said, that impact, lasts for a long time. But I will say that this work is not for the impatient. It takes time, to do this. You don't always see immediately, what the gains are. It takes coordination. It takes collaboration. And so not everybody may be as patient as is needed, but that's what's needed. There are no quick fixes here. And people who are just focused on, kind of short-term results, they're really just Band-Aid solutions that are going to come back, and, like bite us, like the health system is going to crumble. I think the other thing around the fact that the opportunity is now, to do this work is how do we set the agenda? How do we set priorities? And I really do believe that, with more domestic resource mobilization, ministries of health, governments on the continent can actually define what the priorities for healthcare spending should be.
Thank you so much for those insights. So my next question will be around, of course, the whole environmental issue and how it impacts on health, and specifically air pollution.
Yes.
Given that it is the second leading, risk factor for death globally, and how it's also made worse by climate change. So how are you addressing that, dual challenge of, how it's impacting on health? And
no, I love that you asked the question, because there are things that we can do, that actually have multiplier impact. So take air pollution, for example. If you work on air pollution, you're actually going to have a positive impact on health, and you're going to have a positive impact on climate change, by reducing those carbon emissions. So it's, a win-win. And some of the things we're doing include putting pollution air sensors in cities. So cities can, again, understand the scope of the problem, where it is, and identify interventions for that. One of the things that you've probably heard at the conference here is how proud Kigali is around its car-free days, and how that's used to encourage physical activity. It's used to encourage screening for NCDs. It's, becomes almost like a community event, around the car-free days. And so there are things, that, as I mentioned, are very targeted interventions that will have impact on prevention for NCDs and impact on reducing carbon emissions, that will hopefully, work to slow down the rate of climate change.
Awesome. Thank you so much for that. As we wind down, curious to know, because again, when we talk about access to healthcare, it's important to make sure that it's equitable.
Yes.
So coming from your background, leading MSD for mothers and now at Vital Strategies, what are those key actions you believe are necessary to make sure that health is not just effective and accessible, but also equitable?
Yeah. So I will come back to first principles. One, we have to make sure we're counting everybody. We're not just looking at the people who are coming into the doors of the facility. What about all those people who don't even make it to the facility, that are still in their communities? And so we need to have a really good understanding of what the needs are in the communities, and reach out, meet people where they are, and not expect them, to come to the facility, because we know that there are huge barriers. People need to go to work. People need to earn a living. There may not be transportation. People may need support, with taking care of their children. So there are so many barriers, to accessing care that start in the community, not even in the health system. I think the other point around equitable access, I always come back to the data. For me, health equity is more than access. It's actually impact. At the end of the day, we want to make sure that health is enabling everybody to live their fullest life and take, back to, my story of the girl selling fruits, able to realize their full potential. That to me is the metric of success. And so we need to think through how are we actually measuring that? Because right now we don't often have the systems, that allow us to hold ourselves accountable, for that ultimate metric of, does everybody that's born into this world, do they have the same chance to live their healthiest and what I call their most vital life, where they're really realizing their full potential and can give back to society.
Awesome. Yeah. Thank you so much, Dr. Etiebet, for those amazing insights. So this will be my last question. And I would like to circle back to where we started, personal, how the journey started for you. So you've led major global health initiatives, worked across sectors, from improving maternal health to working with government to strengthen public health systems. So my question would be, what drives you, to stay motivated really in the face of persistent global health challenges, because they keep coming, right? And what experiences have shaped your vision for the future of public health?
No, I think, what drives me are, my two children. I have two daughters. I want them to grow up in a world where they can live their healthiest life, irrespective of where they may choose, to live. I know too many people. I have too many relatives that have died in the prime of their life, for reasons that could have been prevented. And so, when you think about this and that this did not have to happen, I don't think you can do anything but, whatever it is you can, to make sure that, no other family, no other child, no other parent, has to lose a loved one, in a way that could have been prevented.
Awesome. Thank you so much, Dr. Etiebet, CEO, President, Vital Strategies, for sharing your insight with us on this edition of Curated Conversations.
Thank you for having me.
Thank you for the amazing work.
Thank you.